going to record this time.
Yeah.
Hello? All right.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression.
Welcome back. I'm Dr. Dudum. This is Back at It with Dr. Decompression. Episode 5. Today's episode is uncovering the magic of non-surgical spinal decompression. In case you missed it, you can go to our episode, subscribe to our podcast. Episode 4, we discussed just sciatica and what are the causes and what can you do, and really sciatica uncovered. If you haven't checked it out, be sure to go back and listen to it. For today, super excited. I'm really excited about this. We're talking about non-surgical spinal decompression. That's what I do now. That's what I do every day. We utilize this amazing technology to help people. Just like in previous episodes, episode 3, I believe, where we talked about my story. And the reason I specialize in this technique is it saved my life. It saved the trajectory of where I was going. And I'm really passionate about bringing this technology through our providers we talk about to the forefront and showing all the listeners what it's capable of doing. Let's talk about what it is. So, non-surgical spinal decompression. Let's start about what was it, how did it get developed, what's the research show, how do we use it clinically. We'll talk about all these things today. Number 1, how did it start? How did it get going? It was created, a technology was created by a doctor, Dr. Alan Dyer, in the late 1900s. So a little over 20 years ago. The technology of not just traction, not just pulling someone. That's the difference between traction and decompression. We're not just pulling someone. The table is pulling and it's reacting to the body weight and the response of the patient. It has a feedback system where it doesn't just pull too much. It responds and adapts to the patient's response to the table or to the weight. And the research that's been done, there's close to 100 research papers on non-surgical spinal decompression. The majority of these papers discuss the effectiveness of non-surgical spinal decompression, helping people with low back pain, helping people with radicular or referring pain. It basically means with sciatica, that's pain down your leg. Could be the front or the back. It mentions specific conditions: sciatica, herniated disc, degenerative disc disease, scoliosis, facet arthritis, spinal stenosis. There's a few other ones, but those are the big conditions that the research suggests. And it suggests with 6 to 8 weeks of treatments, they're going to feel a lot better. Pain-free, maybe, but a whole lot better. How does the technology work? What happens, and again, for our audio listeners, try to just visualize, we're trying to pull apart the spine a little bit. And when we open up the spine, there's compression. So when we open it up, we strap you in. You'll see a visual here. When we open you up, if we get to a certain amount of pressure, there will be an exchange of oxygen. There'll be blood supply and exchange of nutrients. The research suggests through pre and post MRIs, that is 40 milligrams of mercury. I'm sorry. The research suggests that it's 40 millimeters of mercury. At the 40 millimeters of mercury, the pressure is when you'll start to see shifts in the discs. the disc space, the nerves that exit around those discs. There's pre and post MRIs that show an increase in disc space, a reduction in the size of the disc bulge. Well, the reduction of the disc bulge is important because that's what's causing the leg pain and the back pain. So our target at the office in the treatment protocol that we use is we want to get to 40 pounds or 40 millimeters of mercury. That's our goal. Again, that's what the research suggests. So we pull you apart, we try to get to 40 millimeters of mercury, and when we do, again, oxygen and nutrients get absorbed into the disc, and the healing begins. A disc by itself, it lacks the proper blood supply. So it requires an external source of blood supply from bone or other areas. When there's compression and there's not enough movement in there, the disc starts to degenerate or deteriorate because it doesn't have blood supply. We need movement in that region to get blood supply and heal, but also to get inflammation out of the area. There's an exchange that happens. If our spines are compressed, that exchange not only slows down, it's limited. And chronic degenerative conditions occur. And you take that over a few weeks, you take that over a few months, now a few decades, and that's a serious chronic condition. Why is compression such a problem? Would be a good question to ask. So let's ask it. Most of us, we sit all day now. We're sitting more than ever. We have desk jobs. We're sitting. And even the pandemic 3 years ago, and that shift caused a lot of patients to suffer from back pain. When you sit, it's the most pressure per square inch on your discs. So sitting for disc health, spinal and disc health, is one of the worst things you can do. You need to get up every 20 to 30 minutes to walk, to lubricate the disc, to get that oxygen and blood supply going in and out. Sitting, again, most pounds per square inch. Think about that. There's the most pressure when you're sitting on your disc. So make sure you're walking. So again, I keep going these tangents when we're just talking about stuff. Let's go back to spinal decompression. It does relate to disc. So we use a table that's called a DOC, decompression table. I love these tables. We have 5 decompression tables. To give you reference, when I first started decompression 3.5 years ago, again, episode 3, from my story, when we started, I had one table. I fixed my back with a treatment program that I've developed. And now we have 5 tables. We're able to help that many more people, prevent them with injections and prevent them from getting surgeries. These tables they're freaking awesome. I love these tables. What they can do, the lives that they transform, how it works, you lay on the table. If we're doing your lower back, we can angle the table. So the table can change. Your legs can go up or down based on your condition. And that will add stress in a good way. It'll target certain areas of your back. So last episode, we talked about getting a MRI, because the MRI is going to tell you what the cause of the problem is with a herniated disc. How big is it? What level is it? We can use that information and specifically use those tables to target that disc. So it's a specific plan for you. And we put you on the table, we target your disc, and we start pulling, and we start opening up slowly. It takes about 6 to 8 weeks. And when we get to that 40 millimeters of mercury, it's going to create that exchange in the research called a reverse vacuum effect. It's a reverse, meaning all of the stuff that's been waiting to come in is going to come in, and all of the inflammation, all of that's going to go out. It's an exchange, a reverse vacuum effect. That's going to happen. And we pull you 6 to 8 weeks. Not only does it happen, we have the tools in the office through corrective exercises. I keep referencing all of our episodes. Episode 2, my pal, amazing doctor, Dr. Jahangiri with San Diego Chiropractic Neurology, he mentioned the power plate. We have 2 power plates in our office. They vibrate 50 revolutions per second. And that helps, once we get the disc to come back in, it helps stabilize, strengthen those really small muscles. They're called intrinsic muscles. It just means that they're working when you're not thinking about it. My bicep muscle, it doesn't work unless I tell it to move. That is not an intrinsic muscle. An intrinsic muscle is my postural muscles right now that are telling me not to go like this. It's these muscles. The power plate stabilizes those. Once we can fix and permanently get the decompression to get the bulge to come back in, we hammer it with some stabilization of the power plate. It's part of our formula. It's how we're able to help so many patients that have herniated discs, degenerative disc disease, spinal stenosis, facet arthritis, pinched nerves, all these inflammatory chronic conditions. The tables that we utilize are so unique that we can actually target the exact level of your stress. So the exact level of your disc bulge, your herniation, your stenosis, your facet arthritis, your disc degenerative disease, your degenerative disc disease. We can set the table, we can angle it specifically to you. We will run you through the decompression program. We'll do some other ancillary things in the office and the power plate, and that's how we get you back on your path. The tables really are individually set for you and your condition. That's what makes them so unique, and that's why we get the results that we get. I love these tables. Again, they really changed the trajectory of my life. And they've changed the path for so many patients in our office that really had no hope, that either had spinal injections or had spinal surgeries or didn't want that as their path. It's kind of a segue to next episode. Next episode, episode 6, I'm going to talk about 2 specific patients that really we transformed their lives. So we're going to do some patient stories next episode on how we changed their life with our spinal decompression program. So this episode, though, is episode 5. We unraveled, we unveiled, we took the curtain off of non-surgical spinal decompression. We showed you a little bit about how it works, showed you what the research suggests, and I demonstrated kind of how do we use it and why is our table great and how do we help people. So I really hope you enjoyed listening to this episode. Don't forget to subscribe to our YouTube channel and our podcast. I'm Dr. Dudum. This is Back at It podcast with Dr. Decompression. Thanks for listening.